Greetings to all the viewers for this session, specially meant for disc diseases of the spine. I am Alok Ranjan. I am the Senior Consultant Neurosurgeon at Apollo Health City, Jubilee Hills. I am the coordinator for the Department of Neurosurgery, which consists of 7 neurosurgeons, several dedicated trainees in the neurosurgical departments, with its neuroanesthetist, neuro-intensive care, and a dedicated physiotherapist. Today, I will take you through the journey of a disc disease. Now, disc is a very important part of your body. Our spine consists of 7 cervical, that is the neck part, which is, you can see, is very mobile part. Then 12 dorsal spine, which contains the rib cage, and below that is the lower part of the spine, lowest part of the spine, which is a lumbosacral spine. Between each of these vertebrae, there will be a disc. The purpose of disc is to cushion the movement. As you can see, is cushioning the movement. When we are born, more than 90% of the disc constitutes a material which is water, and the rest is a jelly-like material. As we get older, with the use, slowly the water gets lost, and in old age, 70-80% remains water. It becomes more fragile, and you can have disc degeneration, and there are certain processes in which the disc can come out of its normal position. It doesn't come out completely unless you have a heavy trauma. It mostly comes out through a small bubble. And if this bubble can go behind, and if you can see this hole, this is the area where spinal cord, brain gives the spinal cord which enters. The disc is in the front, and the nerves come out at each of these areas to supply various muscles in the body, and the disc is again in front of that. So if the disc comes out posteriorly, it is going to press the spinal cord and is going to press the nerve which is coming out, and depending on which level the disc prolapse has happened, we quite often can make out by the clinical examination itself, and MRI will confirm. Now, degeneration of a disc is a natural process, but it can be worsened by certain insult to disc. The present climate, where younger and younger people have to sit for 18 to 20 hours on a disc job, especially in the IT industry or even the hospitality industry, actually has increased the incidence of disc disease. We know that the spinal vertebrae surrounded by lots of muscles, and the muscles are very important to keep the movement and the tone within the adequate range. If these muscles are not exercised, the pressure which is put on the muscles gets transmitted more on the bone and the disc, and you start developing disc disease. I will come to that, how to prevent it, but first I will tell you what to do. Suppose you have a severe pain in the neck. It is not necessarily that you have a disc prolapse, but suppose that severe pain in the neck is shooting down your hand. In medical parlance, this is arm, forearm, and the hand. The whole thing is called upper limb. If it is shooting down in a particular area, we can say that there is an irritation of that particular nerve root. We know that if the pain is here, it is going to be C4-5 area. Pain is here, is going to be C5-6 area. Pain is here, is going to be C6-7 area. So we can predict quite often which is the suspected problem. But sometimes the disc does not go to the side, it can go to the center. And if it goes to the center, it presses the spinal cord. And spinal cord, you must remember, there are 2 billion nerves which come out from the brain and goes all the way to the body. And if there is a pressure of a spinal cord, you can have weakness of all hands and legs, you can have numbness, you can have difficulty in walking, you can have stiffness. So all these difficulty, neck pain, shooting pain in the arm, weakness of particular muscles, or generalized weakness, stiffness of the walking, slow gait, they can all be due to the cervical disc disease. Cervical disc disease can be a soft disc prolapse, or it can be a very hard bony disc prolapse, or in between the whole range is present. Certain population, certain localities are more prone for these changes, especially in context of Andhra Pradesh, unified Andhra Pradesh. One disease used to be very common called ossified posterior longitudinal ligament, which used to press the spinal cord. So you can be in an area more preponderance to a certain type of disease. Suppose the same disc prolapse happens in the lumbar area. In lumbar area, typically the main spinal cord stops just at the beginning of lumbar area, and below that there is no spinal cord. There are only nerves, which again comes out depending on which level they have to come out, L2, L3, L4, L5, S1. And again they have a specific distribution in the body, and we can tell you from your distribution of the pain which disc is likely to be the cause. Now they have a relevance, because sometimes you can have a similar pain without a significant disc prolapse, and that pain generally comes from the joint. This is called a facet joint. So your brain can misinterpret that pain, and is actually pain is coming from the joint, and then you land up with diagnosed to have a disc disease, and a lot of unnecessary surgeries are done because people do not pay enough attention and do not correlate the clinical symptoms with the findings in MRI scan. MRI diagnosis is always dangerous without a clinical diagnosis. So which population is at risk of these conditions? We know that the neck pain and back pain are the commonest problem in the society. 3 out of 5 people in the working age group suffer from neck pain, back pain at any given time of their life. Fortunately, 90% of them will not even require investigation. But the 10% of them who will require investigations are those 10% who have a specific problem. Remember, back pain, neck pain, or these nerve pressure symptoms can be also a part of infection, especially tuberculosis, which is very common in our country. It can be part of an accident, trauma, fracture. It can be part of a tumor. So every pain need not be disc disease. But the good thing about disc disease is that these are longer standing pain. And most of the disc disease, especially in the lumbar area, the lower part, happen more often on activity. If a pain happens at rest, there is a good chance that it may not be a disc disease. It may be something else. So there are some red flag signs, like you have a fever, and a special area of a spine is very tender to touch, and your nerve problem is increasing very fast. Don't wait thinking is a disc disease. There may be other problems like infections, tumor. But in a disc disease, when we suspect, we must see which disc disease can be managed without even the investigation, which disc disease require investigation, and which disc disease requires surgery. Golden rule is a simple back pain, neck pain, which is related to certain posture, exercise, happening there for several weeks, is not going to be a pathological lesion most of the time. A simple back pain, neck pain should be treated with exercise, not even with investigation. There are exercises which we must do in regular life. There are exercises which are specific to these diseases. If you are in a worry, consult a specialist who will guide you. Going to a gym and suddenly trying to make up for the loss of exercise for 10 years is a very, very bad idea. The muscle requires easing of exercise, not suddenly putting lots of exercise. And that can actually lead to worsening of the symptoms. So when you go to gym, please understand, you don't start with 50 pounds on the first day. You have to tone up your muscles. You have to do gentle exercise and slowly build up. Sins of past cannot be washed away in one day. You have to slowly work towards it. Suppose we have clinically diagnosed that patient has a simple disc disease, no shooting pain in the hand, no shooting pain in the leg, subsides with simple medicine, no weakness, numbness of anywhere in the body, then we can ease off and see whether simple medication, change in lifestyle and exercise can help us. Suppose we come to a category that where already symptoms and signs like weakness, numbness have started happening. In that scenario, we must investigate. The best investigations for disc disease is MRI scan. It is not CT scan. It is a waste of time. Even a simple X-ray is a waste of time. So if you think your symptoms are significant enough, especially if you have neurological symptoms of numbness, weakness, difficulty in walking, you must have an MRI scan done. But before doing MRI scan, it is always good to be examined by a specialist, because it is very easy to miss which area of MRI scan to be done. So often I see patients with cervical disc disease who present with difficulty in walking, and all investigations were subjected to lumbar spine. So clinical examination is very important. Once you have done MRI scan, you may require additional tests like CT scan, which sees the bone more clearly, or you may require an X-ray. They give you additional information for certain treatment protocol. Now, if you find, when do you require emergency disc surgery? There are only 3 indications for emergency disc surgery. A rapid deterioration of neurological condition like weakness, numbness rapidly developing, difficulty in controlling your urine and motion, and in reference to lumbar disc, that is in the lower part, if you have a foot weakness. These are the absolute emergency. Other than that, if you have some deficit and mild deficit and you would like to try a trial of non-surgical treatment, you are allowed with the expert's advice. So once you have a disc disease which is causing significant neurological compromise, you require surgery. Now there are the world of surgery. Unnecessary surgery has to be avoided. There are basically 2 types of surgery. One surgery in which we only take care of the pathology, the disc which has come out, and depending on different area, there are different ways of doing it. But in today's world, we all want minimally invasive surgery. Why minimally invasive surgery? Because it gives you as good a result with very little trauma to your body. But you got to be careful that minimally invasive surgery requires a certain degree of expertise. It requires a specific instrumentation, and in all good hospitals, you will have that facility. I am happy to tell you that Apollo Hyderabad, Jubilee Hills has been pioneer of minimally invasive spine surgery since 2001. We are one of the center for excellence. Then comes some surgeries are non-fusion surgery and some surgeries are fusion surgeries. Fusion surgery, we put screws, nuts and bolts. Now there are cases where nuts and bolts are required to stabilize the spine. But we must also be careful not to misuse it too much, because nature wants our spine to have movement. And if we fix the spine, you are going to pay a price for it after some time. If I fix these 2 bones or these two bones, and then if I have to move the same thing, we will find that there is more movement here now. But if I don't, there is a less movement here now. So excessive movement in the mobile segments becomes a problem. So decision of instrumentation is very, very careful instrumentation. Younger the age, more normal the spine, no instability, we must try to avoid it, because of long-term problems. In cervical disc, you have again, most of the time we do surgery from the front, and it's a very least traumatic surgery where patient can be discharged in 24-48 hours. And of late, we don't even need to put them in ICU in most of the cases. In this, you have simple disc surgery or with the fusion, or a disc surgery where we introduce a mobile segment in the disc area called disc replacement. There are specific indications for these cases, and they should not be just used or misused. In certain cases, we also do disc surgery from the back, either through minimally approaches, or if there are multiple problems with a hard disc and other things, we may need to do a surgery from the back by removing the bone and sometime lifting the bone like a book, or sometime fixing the bone. So there are various operations designed on the neck: anterior, posterior, anterior, movement, motion preservation, non-motion preservation, posterior, motion preservation, decompression, fixation, all these things. Coming to lumbar spine, anterior surgery is not done because the whole abdomen lies. So we go from the posterior, and we have minimal approach. Either we go from the midline or we go from the side, depending on case to case. Today, 95% of disc surgery is done through minimal invasive approach, where we go through a small cut of 1.5 centimeter, and there are special techniques to remove the fragment. A typical lumbar spine surgery, I have a rule of thumb that in 100 patients who have a genuine spine surgery for genuine causes, 85 of them have a very good long-term result. 5 of them have a bad result, and 10 of them results can vary depending on lots of other factors, including no lifestyle changes. So it is possible to get 9 out of 10 very good result. A bad result is nowadays less than 1 to 2%. Of course, surgery is part of the solution. The other major solution is the lifestyle changes which you have led to this have to be corrected, and the patient has to learn to not to worsen it further. Again, in neck surgery, remember, this is the way our neck is. This is the front, then this is the back. Okay? This is called lordosis. This curvature is very important. But what happens in a software company? This is the way people are seeing it. This is called lordose, cervical kyphosis. Bad curvature, wrong curvature. Similar thing in lumbar spine, there is a lordosis. But we sit hunched up like this, and we are bending the spine like this. Posture is probably one of the most important contributor towards disc disease. We must know how to have a proper posture. If our posture is incorrect, we are going to develop a disease. Suppose you have already developed a disease and then you realize you have a bad posture, still you have enough time to correct it most of the time. 90% time you can correct your posture. And one of the good way of correcting posture is, remember, the back muscles all the way from the neck to the back are very important muscles. You will notice that if you sit like this for a long time, that muscle gets fatigued and you start having pain. Then you go back like this and you feel relieved. So the back muscle exercise is very, very good. You must do some physiotherapy, yoga, you must do exercise. Lifting weight is not an exercise. You must do the muscle strengthening exercise. And one of the best exercise for a spine is swimming. If you can just do swimming 4 or 5 times a week, half an hour a day, it will really keep your posture good. Remember, when you swim, you must keep your neck up and the back up. There's a normal posture of the spine is maintained. Physiotherapy, there are certain ways of going about it. Physiotherapy has a acute pain relief. We have some things like IFT, shortwave diathermy. Sometimes we give a traction for the neck. Traction for the back is no longer given. Then we have exercise, a specific exercise, not any exercise. So you have static neck exercises to build up your muscles, strap muscles of the neck. You have isometric back exercises to build up your back muscles. They are very, very important. And all of us should be given a lesson in the school itself. That's why I like in the Western society, every school will have a swimming pool attached to it. And swimming is actually part of their curriculum. Games is part of the curriculum. But unfortunately, due to our socio-economic strata, large population, we are not able to do that in our country. But we have to find a way where games becomes an as important part of your life as the studies are. See, in spite of taking every precaution, there are people who will develop disc disease. But that is not their fault. But without taking precaution, if you develop a disc disease, that is your fault. And then you can only blame yourself. It is very important to have a proper lifestyle, healthy lifestyle. A thin body and a fat body are equally dangerous. A weak body and a person who is doing 200 kg of weight is equally dangerous. We must have everything in moderation. And if we have a good lifestyle, at least devote 1 out of 24 hours a day on your own body. If you have a problem and you reach the specialist early and you have a chance of recorrection without surgery. But in spite of that, if you develop a significant problem, remember 9 out of 10 spine problems are not treated by surgery. And if conditions where they are treated by surgery, 9 out of 10 do well. So it is not end of the world. Apollo Hospital, Hyderabad has a very specific spine suite where we do minimally invasive surgery and we have various navigation related equipments. They are the highest end equipments in the world. OARM is almost like having a CT scan on the operation table. Robotics, which tells you exact precision where to go. You don't require them for all the cases, but whichever cases you require special instrumentation, difficult cases, highly compromised cases, these equipments can mean a normal life from a paralyzed life. We have monitoring. During the surgery, we can monitor the function of the nerve. We can notice whether they are worsening or not. We can notice whether they are improving or not. So everything available in this world is available in our spine suite. And you're most welcome when you need us. I only hope you don't need us. But when you need anyone, reach the specialist faster. Today we have an unusual situation where the whole world is grappling with a COVID virus, where because of its infective nature and slightly dangerous outcome in certain number of people, everyone is worried whether to go for treatment or not. We have to understand one thing, that in near future we have to learn to live with this disease. So precaution is important. Fortunately, 90% of the patients who will get this virus will not have any problem. But precaution is important. I have only one solution for everyone. Just don't be the cause of a problem for someone else. If we all think that we do not want to harm someone else, we all will be fine. Now in this present scenario, like all hospitals, Apollo Hospital Hyderabad has to deal with a situation where we have to take care of the patients who could have COVID and the patients who can have normal illness. It's a very challenging time, but because our expertise in these things, we have a very well developed system. We have a COVID specific ward. It means there are normal patients ward, and the patients in those normal areas only get admitted once we have ruled them out of COVID. And we can rule them out of COVID by doing certain tests such as RT-PCR, sometimes CT scan of the chest. And once we are confirmed that these patients do not have COVID, they are mixed with the patients who also do not have COVID in a separate section of the hospital. Even our operation theaters are very different. Even if you have a suspicion of COVID not proven, you are not operated upon those operation theater where only COVID-free patients are operated upon. As a result, in spite of doing several elective semi-emergency operation, we have not lost a single patient, fortunately, in our system because of hospital-acquired COVID problem. Right from you coming in a mask, your patients coming in the mask, minimizing the number of people who come to the room, to the entrance where your temperature is checked, where your symptoms are noticed, your details are taken, to the consultant chamber where minimum number of people are allowed, frequent wash is done, there's a screening so that you are safe from the doctor and doctor is safe from you. To the investigation where everything is done in the same COVID protocol. Ultimately, if you require operation, you go to a COVID clean system. It is our job not to prevent people needing medical services coming to the hospital because they are scared. We should be scared of COVID, but our life also must go on. And we are fully prepared. We have got the art of preparing ourselves and the patient in last 5 months. And that is the greatest boon, that we are a very safe place, partly because of the design of our hospital is very windy, windows and other things. Partly the screening process we take and the care we take in preventing mixing of suspicious cases from the normal cases. Every operation can go on and is going on in our hospital. I think we are a facility which is very, very safe. But I want you also to understand that you also must be safe for other people. If you can't do simple things like wearing a proper mask, doing frequent hand wash, making sure that you don't unnecessarily party with people who are not your family member, you can be a help to society. And the hospital, especially Apollo Hospital, is always there to help you. We have not stopped working for even a single day since March. Our systems are working. Cases are going on. Patients have not got infected in the hospital. We are quite proud of it. It is a lot of work for us, but we are there to take care of you. Thank you.